like to introduce you to Dennis. Now, Dennis came into me because he had had trouble with one of his front teeth. It had gotten loose over time, and his previous dentist had actually stuck this tooth onto the neighboring teeth to secure it. It was that loose because it was about to fall out. And he just thought, you know, his gums got redder and they got more swollen, and he just thought that there should be something better that we could do for his teeth. So he wanted a permanent fix. He didn't want any more patch-up jobs. And that's what's been happening all his life. You know, he really didn't have very good care of his teeth. You know, he had a lot of gum problems. You can see the redness of his gums here. But also this particular tooth, if you have a look at that, see how red and inflamed those gums were. He had a huge infection, in fact. In fact, what had happened is he had a post put into this tooth, and the post had fractured the root. And with a split root in his mouth, basically the whole infection had eaten away all the bone inside here. And what we're seeing here is all the pus coming through in the gum. So anyway, what we had to do, this tooth had to go. So we took this tooth out, and we ended up doing a bone graft to fill the big hole and the big void that the tooth had eaten out. So he had a missing tooth there, and initially he was wanting to have a single implant to put in there. But what I realized after doing all the measurements of his teeth was that this gap here was actually larger than this tooth next door. So he was either going to have a gap right in the middle here for two even-sized teeth, or one big implant fat tooth and one normal-sized tooth, which he didn't want, and he didn't want a gap either. So he decided that he would actually do some cosmetic work over the front teeth as well, make his smile look a lot better, get rid of some of the gumminess, and also to close this gap with more even-sized teeth. So what we decided in the end was, because of all the bone loss that he had had, it was easier to mask it with a bridge than with an implant, and also to correct the proportions of his teeth. So that's what we did. We did a bridge there instead. So you can see a close-up there again. See this, all this gunk in between here, that's actually where he had filling material put in there to stick this tooth, this loose tooth, onto the other teeth. And this is Dennis at the end with his new bridge. You can see he's smiling from ear to ear. He actually had this bridge put in just before his son's wedding, so he was very, very happy. It was done all on time, and that's a close-up of his teeth. And you can see here, this was the place where the tooth was missing. We did the bone grafting. We made the gums, we shaped the gums, and we lasered the gums, and actually created this sort of shape so that it could look exactly symmetrical to the tooth next door. And we were able to close that gap for him and also give him a more beautiful smile all the way across.